calciphylaxis. What do you mean by calciphylaxis? The calciphylaxis term refers to uremic, uremic calcific, uremic calcific arteriopathy. So uremic calcific arteriopathy. What is the basic concept of this uremic calcific arteriopathy? This is very simple and straightforward. Answer is, it is dissemination of calcium, or you can say disseminated calcification in the vascular system and associated with the skin necrosis. So what happens? There are a lot of factors helping this calcific deposition into the vascular system, which ultimately results in painful gangrenous lesion, and ultimately that is superseded by sepsis, and hence mortality is very high. So let us talk about what is calciphylaxis. This is generally a feature associated with secondary hyperparathyroidism. So associated with secondary hyperparathyroidism. What is calciphylaxis? What is calciphylaxis? This is disseminated calcification, disseminated calcification resulting in yes, blockage of vessels with skin necrosis, Now if you talk about the sites, where is it commonly seen? It is commonly seen over the lower extremities and also over the lower abdomen. So sites, if you talk about the sites, it is extremities and lower abdomen. If you talk about the features, the standard feature is painful calcific deposition, resulting in generalized gangrene of the overlying skin. So painful necrotic ulcerations, and why these ulceration happens? Because of the ischemia. Why this happens? Because of the ischemia. So there is ischemic necrosis of the skin. So painful necrotic ulceration and all these things are because of the ischemic necrosis. Now what is the cause behind this? Everything has a cause, yes. So what is the cause behind this? Answer is, in patients who are having CRF induced uremia, there is decrease in calcification inhibitor factor. Calcification inhibitor factor. Now this calcification inhibitor factor is decreased, and therefore there is generalized dissemination of calcium deposit and hence calcification. There is also decrease in alpha 2 HS glycoprotein. Yes, it is also known as Harriman's Schmidt. So alpha 2 HS glycoprotein, if there is deficiency, it will again promote the calcification. So these two are important reasons for calcification, and then the end result is because of this ischemic necrosis, there is a superseded risk of sepsis and hence the mortality. You know, mortality is very high, and what is the management? The management is early total parathyroidectomy, so that you control this scenario which is going on. It has been seen that early parathyroidectomy reduces the incidence of amputations. We have one more very interesting phenomena which is a consequence of hyperparathyroidism. This is hungry bone disease.